Good morning, everyone. I am Trevlon Matanga, and I am going to present on the topic drugs used in radiology. I will be presenting on the drug named Ethiodized oil. This drug has the brand names Lipiodo or Ethiodo. The generic name of the drug remains Ethiodized oil. There is given a picture of the drug. You can see as it is given there. That is how the drug is printed when it is bought from a pharmacy. Going on to the background of the drug, ethiodized oil is used as a CT diagnostic agent for liver tumor detection, especially hepatocellular carcinoma. It is used as a radio-opaque medium for hysterosalpingography and lymphography. Hysterosalpingography is an X-ray procedure of viewing the inside of the uterus or the fallopian tubes. Hysterosalpingography, it is used to view whether the inside of the uterus is a normal size or not. Lymphography is used in lymphography. Ethiodized oil is inserted or it is administered by canalization to a lymphatic vessel to view the tumors of the lymphatic system. Going on to the next slide and continuing on the background of the drug, ethiodized oil is also used as an anti-neoplastic agent when part of the iodine is iodine 131, the radioactive iodine. Ethiodo or ethiodized oil belongs to a class of drugs called the iodinated contrast media, which means the drug in its composition contains iodine. Ethiodo can be used alone or with other medication, which means it can be used as a part or it can be used as a composition, a part composition of another drug or of another mixture of a drug, or it can just be used alone as it is. Going on to the mechanism of action of the drug, ethiodized oil is selectively retained in tumor vessels for long periods. In this way, it is used for imaging lung, stomach, and thyroid. We find out that when ethiodized oil is administered or introduced in the body, it stays for long periods in the tumor vessels. Therefore, it can be used for imaging the tumor, the tumor of those vessels in which it is administered to. Ethiodized oil is labeled with iodine 131 or other beta emitters. This labeling tells itself that ethiodized oil is iodine 131 in its composition. Therefore, ethiodized oil can deliver a high internal radiation dose to certain tumors. It has a minimal effect on healthy tissues. Urinary excretion eliminates iodine in drug from the system, which means one of the ways by which the iodine, which is part of the drug, is eliminated is by urinary excretion. Going on to the pharmacology of the drug, pharmacology is the study of how the drug affects the biological system and how the body responds to the drug. The oil is composed of iodine combined with ethyl esters of fatty acids and poppy seed oil. Ethiodol has certain side effects when used. We find out that when ethiodol is used, there are certain reactions of the body, the reactions of the body to the drug that take place. Some of these side effects include difficulties in breathing, swelling of the face, lips, tongue, or throat, abdominal pain, anxiety, vision changes, chest pain or pressure, to name a few. The most common side effects of ethiodol are delayed healing at the injection site, which means we have delayed healing at the injection site where the drug is injected on the body. That part of the body delays in healing. Continuing on the pharmacology of the drug, the following administration of ethiodized oil remains in the body for several months. This interferes with thyroid function testing for up to 2 years. Ethiodized oil interferes with radioactive iodine uptake by thyroid tissue for several weeks to months, which means when ethiodized oil is used, if you want to test the thyroid functioning, it becomes impossible, or the results are not clear, because it interferes with the ethiodized oil interferes with the uptake of the iodine, radioactive iodine, by the thyroid. So we cannot use any imaging procedure and get accurate results or clear results because of this hindrance by the drug. Overdose may lead to respiratory, cardiac, or cerebral complications, which can potentially be fatal. And going on to the routes of administration, ethiodol is given by injection and builds up in the blood and lymph vessels in tumors. So it's one of the ways, or the given ways, in which the drug is administered to the body. It is by injection. In radiology, it is used for hysterosalpingography in adults and lymphography in both adults and pediatric patients. So as it is mentioned there, we find out that in lymphography, it is only applied to, the drug is only used in adults and pediatric patients. But in hysterosalpingography, it is only applied for adults. An example in which the drug is used in radiology, as I've mentioned earlier, that it is used in hysterosalpingography, in which we use X-rays to view the inside of the uterus or the fallopian tubes. We can also use the drug to see whether the fallopian tubes are partly closed or are fully closed, are partly blocked or are fully blocked. In lymphography, ethiodol is administered by canalization in the lymphatic vessel to produce images of the tumors in the lymphatic vessel. That is all for this presentation. Thank you.